we entered this movement full time because the state of Indiana took away our foster care license to care for foster children in our state. Their justification was that we don't vaccinate our biological children. The cultural shift will not fail.
Right.
Research shows that you will achieve a cultural shift if you reach enough people. There needs to be an understanding that this is about the flow of information and this is about America making a choice. And when America has the information and can choose for itself, we can make America healthy again. If the American people know the truth about these nonsense policies that hurt people, that they won't survive, that we can turn this around.
Leah, thank you so much for joining us. What an exciting week, and we have a lot to look forward to next week. Appreciate your time.
Absolutely, it's great to be here.
What are your biggest takeaways so far from the momentum of the past few months, the first 100 days of Secretary Kennedy? What are your biggest takeaways?
Well, I think that one of the things that HHS is really contributing is the undoing of systematic censorship. Mm-hmm. And that's exactly what the promise was going into Trump's administration, and Secretary Kennedy's confirmation was that they were going to bring radical transparency to the American people. And that's exactly what we hope to see. If we can start there, I mean, how much further along will we be for the American people to get to choose and decide and pursue health in a way that is best for them and their families? And that's why Stand for Health Freedom has been going to bat for moms for the last 6 years, for these exact issues.
Tell us about your organization and a little background for our viewers.
We are focused on policy work. We educate the public so they can understand the significance of the issues, but then also engage and help influence policy, help shape policy in their own communities, their own states.
How did you start this?
There's so many different ways that people choose to join the health freedom movement. Mm-hmm. And one of those is because they experience an injury or a devastating loss because of a side effect that was known to the medical provider but unknown to them. That's like my good friend Vera Sharav. That's why she entered the movement. And other people enter because they simply understand that the demise of health freedom is the demise of all freedom. Yeah. And others because they want to say what goes into their body. They care what food they eat, what pharmaceuticals they participate in. And for me and my family, we entered this movement full time after being in law and natural health, but because the state of Indiana took away our foster care license to care for foster children in our state. Their justification was that we don't vaccinate our biological children. And with my background, I knew that no law had changed, no new science, no new regulations. So what's going on here? And it was the same impetus that fueled all the COVID lockdowns. It's federal money, it's big money fueling pressure for compliance. And it wasn't me that got hurt by that. It was the kids who were sleeping on DCS's floor waiting for a home. And my home was deemed unsafe, that my 2 sons were a threat to their welfare. So at that point in time, my husband and I looked at each other and said, this is too big to fight, but it's too big to walk away from. And we know that if the American people know the truth about these nonsense policies that hurt people, that they won't survive, that we can turn this around. And this point in history where we're sitting today, when we started Stand for Health Freedom, our main goal was let's get to that tipping point. Let's get to that 3.5% where the cultural shift will not fail. Research shows that you will achieve a cultural shift if you reach enough people. And so let's get there. Let's gather the troops. We're close to 1 million now of people who have taken action with us. Wow. And I believe, as you and I sit here and talk, that we are at the tipping point. It's just operationalizing the change now. And that's what we hope to see in this commission report.
Do you remember how you felt back then when you were first starting this? Did you ever think about how it would feel to actually witness this pendulum swinging back? I mean, did you ever imagine that we would actually get here?
Not this fast in our lifetime. It's pretty gratifying to see the airwaves open up to very critical conversations. And there's still a lot of work to be done. That goes unsaid. But, from our perspective, people have a right to unbiased information and to make decisions based on that. People have a right to access the care of their choosing, whether it's conventional or holistic, and that all those decisions should be kept private and never used against them. Amen. And so when you look at that overlay And now these issues being brought to the public, you know, it's not on us only. It's not on you and I to simply tell our sisters and our neighbors, but we have the help of the administration to trickle down and undo systematic censorship in a way that affects every single pillar of modern medicine. And that's huge. It's huge to just tell the truth about fluoride, about pesticides, about the vaccine schedule. I mean, the list goes on in terms of the ways that our children will benefit and the ways that we can minimize unnecessary suffering by having the support of Secretary Kennedy and the
education. Exactly. As far as the MAHA Commission next week, what are you most focused on as making sure, like what message do you think we should make sure gets out there to the American people?
There needs to be an understanding that this is about the flow of information and this is about America making a choice. And when America has the information and can choose for itself, we can make America healthy again. And there needs to be some robust discussion around critical issues. And there are some really good signs that those issues are going to be completely explored. So we hope to see that things such as non-native EMF, our water supply, the quality of our air, the unstudied vaccine schedule as a whole, and also things that HHS is funding, such as mental health care in schools and primary health care in schools, that we have work to do to put the power back in the hands of the parents, not just the people, but the parents to make good decisions for their children.
The parents that have been silenced for so long, that have been called radical, conspiracy theorists, they've been robbed. They got the power to actually parent their own kids stolen from them by the government, by big food, by big pharma, by big agriculture. And you're right, we deserve to give that power back to parents like yourself. So
one of the things I'll tell you that we hear in the halls of government, because we do work at every level of government, is that the schools have to step in and solve the children's problems because the parents don't care. And I want to tell you something that's absolutely not true. That is a broken narrative. It's pervasive in the halls of government. But the encouraging part of that is that Secretary Kennedy doesn't believe that parents don't care. President Trump and his administration, they do not believe that parents don't care. And so we have the chance to break that narrative and really put the power back in their hands and to truly listen and empower.
Yes, a lot of work to be done, but we actually have people now in this administration that want to listen. They want to hear from the forgotten parent, from the forgotten American, and that's exactly what this movement and the MAHA Commission is all about. Thank you so much for being here with us and for sharing your story.
Absolutely. Appreciate it.
God bless.